Welcome back to the Girl Doc Survival Guide. It's post-Thanksgiving, and I just wanted to give thanks and record some things that I'm grateful for. For one, I'm grateful for this podcast and for anyone who's listening in, and especially I'm grateful for the people who are willing to talk to me about things that get me thinking. For example, recently, Dr. Claudia Mello-Thoms told me that perception is actually subconscious. What I perceive, for example, under the microscope when I'm making diagnoses for dermatopathology is actually subconscious. And whenever I'm trying to explain what I'm seeing, that's actually then jumping up to consciousness and trying to use words for what I've seen. Either next week or the week after, I'm going to release a conversation that I had with Dr. Gilbert Welch, who has written about overdiagnosis, detecting cancers that would not have had an effect in terms of any type of symptom or ultimate death for a patient. As a dermatologist and also a dermatopathologist, I definitely want to do my best to give patients the right diagnoses and not the wrong ones. Importantly, overdiagnosis is actually a correct diagnosis in terms of pathology. So it's not really a concern in the sense of giving the patient the wrong diagnosis, but ultimately giving the patient a course of treatment that might be unnecessary overall. Dr. Welch pointed out to me post-conversation that we might be expecting too much of pathologists, given that it's one static time point in which tissue is taken, and cancer is a dynamic disease. Perhaps we should be more open to the idea that one time point, one tissue sample might not be enough to know what's going on. I'm grateful for both of those conversations. Please tune in to Dr. Welch's conversation once it's released and listen to Dr. Claudia Mello-Thoms if you haven't already. Thank you to everyone who is a part of the community that I have around me